Good morning. I'm Rick Pollack. I'm President and CEO of the American Hospital Association, and I think you all know that we are seeing historic, if not unprecedented, change across the entire healthcare landscape. And that's why we really appreciate your joining us this morning for an important discussion, a discussion about how healthcare is transforming, how market forces are driving this rapid change, and how the hospital field is changing to meet patient needs.
The more we have conversations together, I think hopefully you'll see the more we have in common, and that really gives me a lot of hope for the future.
The other thing that really is exciting is what Dr. Howell and others are doing, which is we are seeing big players come in and genuinely make healthcare nationally competitive on every dimension, where healthcare is no longer a bricks and mortar business, it's an information business. Because it may seem like a neat trick that we could tell sex from a retinal scan, but when he can do a lot of other things with that information, that means we don't have to build a facility necessarily to do that. That's the technology really adding value and changing how we provide access. And I think there's a huge opportunity there that's really exciting. And whether that's, when we see CVS and Aetna with 10,000 points of presence across the country trying to be the front door to this whole system, or whether it's, I think Rick mentioned, Optum and DaVita, which if that deal closes, they're the largest employer of the physicians in the country, bar none, right? Nearly 40,000 physicians. And that's the part of the system people really care about, which I think is it's interesting. We in the system tend to take a system view. If you look at where healthcare costs go, it's 38-ish% goes to hospitals. If you look at where people spend their out-of-pocket money, the thing that influences their behavior, only 9% of that goes to hospitals. They spend 50% of their out-of-pocket money on drugs and primary care. That's the thing they want, right? That's where their out-of-pocket dollars go. And that's the thing we have to make accessible to them. And that's where being an information business is incredibly powerful.
We figure out how to do the right thing for the person who is asking for help in whatever context, we're going to do the right thing. Mm-hmm. And if we think about if we do the right thing there first, and then the next order of priority is that we think about the person who is providing the care, who is at the front line, the physician, the nurse, the pharmacist, the physical therapist, and we help them do their job better, then things will get better.
Every healthcare leader in the country, including the three on our panel here, have to figure out what the future state and the future role of their organization is, knowing that as disruption takes place in the healthcare field, any prediction is uncertain and likely to be subject to change.
Focus on managing aligned lives in communities, not running hospitals, but aligned lives in the communities we serve. And so when we think about partnerships, we think about it pretty broadly, frankly. A lot of people have commented in the last few months on a partnership we announced with General Motors around GM Connected Care, where a large employer who's been searching for a long time to find ways to address the health and wellness of their employees, and frankly have tried a lot of things and as most have done, have failed at a lot of things, said to us, would you help us around value, around access, around quality, and around cost management and overall health of our employee base. And so our Connected Care partnership is a unique one where as we say, both organizations sort of opened our kimonos, if you excuse the expression, to sort of talk about how do we really work together and share costs, share pain, share incentives, and hopefully share the outcomes of a healthier employee population. One of the things that I get really excited about is technology. So while I'm not trained in technology, but I began my career 30 years ago with a CEO who said, I would like to remove all the paper from our healthcare system because it's a waste. And so I think about artificial intelligence, and some of our prior presenters talked about that. Henry Ford has, over the last 3 years, sponsored an artificial intelligence competition with startup companies, frankly, in Israel, to help us solve a problem. And so our clinicians and our administrators put together an issue, and we put that out to 40 or 50 companies, ask to have them help us solve it. So for instance, today we're trying to solve the issue of overuse of imaging and using artificial intelligence to help our clinicians make better decisions to reduce the use of imaging to drive costs down. When we think about the Henry Ford promise, not unlike what Elliot highlighted, so for us, we use the term True North as sort of our commitment to to the communities we serve, and we say that, and again, not unlike Elliot's organization, we strive to be the trusted partner in health, leading the nation in superior care and value. And in doing that, we think about safest care and best outcomes, exceptional experience, affordable care, and inspired and compassionate people who all revolve around the customer, right? And to Dr. Howell's commentary, when we talked about customer, a lot of our clinicians said, don't call our patients customers. They're not customers. They're seeking our help. They're seeking our guidance. And what we said is, we're engaged in a trusted partnership relationship with this individual who does need our help. But if we don't treat them like Nordstrom's treats their customers, or like Amazon treats their customers, or like a physician in a patient relationship who wants to be that trusted individual treats that patient, we're not going to win.
We're working deeply with primary care clinicians, so there's a real sort of back and forth. Again, agnostic to EHR, which solves that issue. But that's another sort of big place where we're investing. You heard it from the panel previously. If we're going to create value, we need a very strong foundation for primary care. So we are in the midst of more than doubling the number of lives that we're managing through primary care. And at the same time, we're reimagining primary care. There are serious workforce issues. There will never be enough people. So we are figuring out how do we work differently, both when it comes to people and the teams that we're creating, but then how can we use technology, some of the new technology, so that we can create what we're calling radical convenience. It's all about that relationship. It's all about that experience. We want to be there for you whenever you decide that you need us. And I would say even more, using this data and the technology that we've developed, we want to be able to reach out to you and engage you at a moment that you may not even realize you're at risk. But because we have created that relationship, we can do something different and manage the outcome differently. As I mentioned, we've got about 100,000 lives that we're managing on this platform, about 50,000 Medicare beneficiaries, but we also have a relationship with the state. We're managing about 30,000 state employees and dependents, our own employees and their dependents, and a whole variety of smaller niche programs. But across the board, we've been able to demonstrate improvements in quality, reductions in costs, delight from both the patients and the families and the providers. And it's taught us so much about how we also need to engage differently with our community. To the point that has been made several times, we can't do this alone, and some of those new partnerships that we need to forge are deep partnerships with the resources that exist in the community, so they can partner with us and impact health. They're not used to it, and so I think no surprise, the outcomes in terms of experience that are there for those people on this platform has really been extraordinary. Great. I think what has surprised me, and probably shouldn't have surprised me, is the delight that the primary care physicians are experiencing with this, because they've never before had access to the kind of services that we're providing virtually. We deploy iPads into the physician practices so they can, in the room with the patient in rural Delaware, they can connect with a clinical pharmacist. They've never had that resource before. And so, I think that, again, using technology, we talk about algorithms for empathy. And it's not just about the patient, it's also about the person who's providing the care.
Wonderful.
Come to our industry from retail and technology. They're not healthcare people. They've literally reimagined urgent care in a way that the net promoter scores are 85. Unheard of numbers. busting through the roof. We also, the last one I'll mention is we have a partnership with MIT. And the MIT folks are working with us in our ORs around maximizing utilization, staffing, scheduling, all using digital and predictive analytics capability in a way, again, our current team would have no ability to be able to bring to fruition. So there's a lot of exciting things starting to percolate and take hold and starting to make a difference.
Terrific.
Just a couple of quick takeaways. I think what you continue to hear is the issue of partnerships between hospitals and health systems with folks in the data and technology area, all directed at trying to improve the patient care experience. I really am pleased that the issue of workforce came up because that is obviously so important. And through the AHA's Physician Alliance and through our organization of nurse leadership, we are really focused on the issue of improving the workforce. There are so many dimensions of that in terms of our workforce practicing, as was said earlier, to the top of its license, of training folks to be able to provide care outside of the traditional settings of our buildings, to building cultural competencies as we strive to take care of diverse populations that we see as becoming more important in the future. And trying to deal with issues around violence. You know, one of the challenges when you talk about burnout is the issues that our providers confront related to workforce violence in the workplace. And a lot of that stems from issues around opioid abuse and issues related to behavioral health. And we even have our own Hospitals Against Violence campaign. And then the last thing, and let's not get it lost, modernizing regulations. You know, Elliot put the issue of discharge and that word on the table. But, you know, the Stark laws in particular really, as Janice was saying, are obstacles for hospitals and physicians to work together and be aligned. And those laws were created in the 80s for a whole different system that existed at the time. And the compensation models for that really need a new look. And in that regard, the administration, they've sent signals from the top that they are really focused on updating and modernizing those laws. So Yogi Berra once said that it's tough to provide predictions, especially about the future. I prefer the quote from Abraham Lincoln, which he said the best way to predict the future is to create it. And as the healthcare shifts from a value-based system toward a value-based system, we're trying to build sustainable, coordinated networks with the scale and scope to innovate, to compete with new entrants that are entering the healthcare marketplace, and more importantly, to make care better for the people that we serve. What